So we have Dr. M Sridhar. He's practicing in Delhi, NCR. So would be asking some of the questions from kidney stone management perspective, and would love to know if you could tell us why there is a constant rise in this problem these days.
See, we are actually living in a stone belt. Northern India is a stone belt.
Okay.
And it's the quality of food, the quality of water, and the uptake of water, whether limited quantities or the dehydration factors. All these factors play a role, and it is increasing because of the changes in the dietary habits of the youngsters these days.
True, true. Well, if you could recall any such case which you have ever dealt with a patient who came very late when it comes to his kidney stone, and you did a great job with him or her. So would like to recall that.
Sure,
sort of
yeah, we have had a few patients who came in such late stages when the kidney stopped functioning.
Oh.
So these are the cases where we cannot offer them much as far as the stone removal is concerned, because it's not going to help them.
Yeah.
So we got certain investigations before surgery to see whether the kidney will at all function after stone surgery. If it is not worthwhile, they have landed up in removal of the kidney.
So what did you do that time?
Yeah, of course, we have to tell the patient we got two options. One, remove the stone and give kidney a chance, but the chances are very less. You're going to keep having problems like infection, pain and bleeding and all. Or better to get it out if the other kidney is functioning well. If one kidney is functioning well, there is no harm removing this one.
Yes.
But then the precautions that the other kidney should not develop a stone is always there.
True,
that
true.
we tell the patient. You have to take care of it.
Well, when we are talking about precaution, in your experience, what precaution a person should take in order to avoid the stones, and if he have already one, in order to avoid the recurrent stones?
Recurrence, one is the water intake. I will emphasize more on the water intake rather than the diet.
What is very important?
Yeah, water intake in northern India, at least I would advise 4 liters of water intake in summertime, 2 to 3 liters during winter time. And the water should be of good quality, not necessarily RO or anything, but it should not be hard water. The contents of calcium oxalate and all should be less in those, and the magnesium should be good. So these are the factors in water which play a major role.
Well, water intake differs from person to person, or it's 4 liters for everybody? Would you like to say?
It depends on the body weight.
Is it?
And if the patient has a cardiac condition or a pulmonary condition or a kidney condition, we cannot load them with water. We have to restrict.
Yes.
So they are the ones who are in trouble because they cannot take too much of water. At the same time, they are suffering from stone.
Okay.
Yeah, we have to balance the two.
Any indication that we get to know that yes, we are taking enough amount of water? Any indication?
Yeah, see, ideally a patient should pass urine in 1.5 to 2 hours of time. That's a good indicator of a good water intake.
Okay.
If the patient says, I pass urine once in 4 hours, 5 hours, that means the water intake is not good. Yeah, if the kidneys are functioning good.
That's a good point. Well, what do you think it is going to be a major breakthrough when it comes to kidney stone management?
Yeah, ultra fine flexible scopes these days are available, RIRS. We are having refinement every year, and I think that will go a long way in treating the stones with less pain and bleeding compared to PCNL conventional, which has an incidence of bleeding and morbidity.
Any misconception you would like to break here? Any myths a patient might come with?
So the myths are a small stone lying in one corner of the kidney. The patient always feels that everything has to be taken out. It has to be, like jhadu mardo. But that is not possible. Small stones lying in one corner of the kidney peacefully, not creating problems, can be left alone as such. But then precautions as to say annual ultrasound or annual checkup as far as that stone is concerned should be there.
Thank you so much, sir, for your valuable answers.
Thank you.
Thank you.